Hello, my name is Isabella Huelsbeck and I'm here today to discuss something very serious with you. Clinical depression in adolescents. This isn't going to be like the usual videos you see online where somebody talks about their personal experience with depression. This is going to be an informational video relaying information about depression. Now, I am not a professional counselor, so I have asked Mrs. Ellen Baker, a professional counselor, to answer some very common questions about depression. And she works with adults and adolescents, so she is the best person to relay this information to you. The reason I'm making this video is because I personally have not dealt with depression, but a family member in my family has dealt with it. When they came to me to tell me about their depression, the first thing I asked was, how can I help? And what can I do to help? They didn't have a specific response for me, but they did point me into a right direction. I wanted to help people that are either affected by depression or know somebody affected by depression, to give some advice and give information about it just so that they can know what to do and how to help. And now on to the answers with Mrs. Ellen Baker.
So many of us, during times in our lives, will experience times of sadness, maybe a depressed mood, feeling low or feeling irritable. And what makes that different than clinical depression is that clinical depression has symptoms that are much more severe and they last for a longer period of time. The Diagnostic and Statistical Manual of Mental Disorders refers to clinical depression as major depressive disorder. And there are a number of symptoms that have to be present for an individual for them to receive that diagnosis. They need to be experiencing these symptoms most days, nearly every day, for a period of at least 2 weeks. So there are a number of symptoms that would be in place for a person to be diagnosed with major depressive disorder. A person typically would have a depressed mood, so they would feel sadness, maybe hopelessness, loneliness, and irritability. They may have a markedly diminished interest in activities that used to bring them pleasure. They may lose their appetite, or they may have an appetite where they feel like they just want to eat. They may increase their weight, or they could lose weight if they're in a major depressive state. Oftentimes people have difficulty with sleeping, so they may be sleeping too much, or they may not be able to fall asleep or stay asleep. Typically people have feelings at times of feeling very worthless. They may have feelings of guilt. Sometimes people do experience thoughts of death and may contemplate suicide. And there can be times when people feel that they're having something called psychomotor agitation, where they feel like their bodies are very agitated and they have a hard time sitting still. Or a person could go the other direction and have something called psychomotor retardation, where they feel that they move very slowly and they have a hard time doing everything that they need to do. Many times with depression, a person feels very, very fatigued and has difficulty concentrating and thinking and keeping focus as well. So it really depends how having depression during your teenage years affects you ongoing or in the future. Some adolescents experience depression in their teen years and then never have another depressive episode in the rest of their lives. But others may have experiences where they continue to have times where they do feel depressed and may need additional support or treatment during those times. So it really just varies on the person, and if they are able to get support and utilize resources to help them manage their symptoms. What gets really difficult for the adolescent who is experiencing depression is that if the depression continues, it can really affect a lot of things. It can affect their academic lives, it can affect their social lives. They're at a period of time where they're trying to become more independent, and that may feel a lot more overwhelming for the person than it really needs to be because they are going through a period of depression. Also with college and decision making with careers, again, it really can impact the way the person feels, the decisions that they make, and their outlook on life. In addition to some of the factors that I mentioned that may be associated with depression, a person may also experience anxiety. So they may have times where they feel very depressed, but also very anxious, which can make things feel even more complicated for a person. So it's not uncommon that a person will have a lot of anxiety, may have experiences where they're having panic attacks, and have a very difficult time thinking about things over and over and worrying about things and worrying about the worst case scenario. So there are a number of disorders or behaviors that can be associated when a person is depressed. If the person continues to be depressed for over a 2-year period, they would likely be diagnosed with something called persistent depressive disorder. So this is where those symptoms have been very present most days, nearly every day, for a 2-year period of time. Sometimes people who end up being diagnosed with bipolar disorder, which is where they can have really low lows and really high highs. Sometimes that starts by going through several depressed states when they are younger. Suicide and suicidal ideation is always a risk when a person is depressed. Unfortunately, those types of thoughts a lot of times go along with being in a very depressed state. And sometimes the person really isn't necessarily wanting to kill themselves, but they may just be so overwhelmed and have been in pain for such a long time that it feels like it could be a solution and escape for that person. So there are some risky behaviors that can be associated with depression. Sometimes people experience things like self-harm. They may have other type of difficult behaviors that they're experiencing, like substance use, so drug addiction, alcohol addiction, eating disorders are associated sometimes with depression, and a lot of physiological issues can come up for a person. When a person is under extreme periods of stress and their sleep is affected and their appetite is affected, it just naturally follows that they may have physiological issues that develop after that. Yes, so that's a very good question. So if you have a friend who comes to you and shares that they are experiencing depression or maybe some other mental health problem, I think the best advice I can give is to really just do the best you can to listen. Oftentimes this may be the first time that they've actually shared that they're going through something that feels so hard and difficult. So listening to them, also validating them and letting them know that you can only imagine how difficult this experience must be for them can be really important for that person to experience. And sometimes it's really helpful for them to feel like they've been listened to, so then they start opening up to the idea that maybe there is hope and maybe they can get support. Now, it's a difficult position to be in as a teenager when you have another friend who is coming to you sharing those struggles. So while it's important for you to encourage that they do let someone know, preferably their parents or some other trusted adult, it's also important that you get help as well, because this can be a lot to hear when you're listening to friends who are having such difficult struggles going on. And sometimes as a friend, we have to be in an uncomfortable position and make a very difficult decision to let other people know. So if you have a friend who's experiencing depression and really needs help, maybe they're experiencing also suicidal thinking or engaging in self-harm or using drugs or drinking, as a friend, you may have to make a difficult decision to let an adult know, because the adult can actually help this person access resources that they need. And depression is very, very serious, and lives have been saved by a friend having the courage to bring attention to what is going on with someone that they care about. So fortunately, when a person is ready to get help, there are a lot of resources that are available. It's very important that they let their parent know or their school counselor know, so that adult can assist them in locating these resources and accessing them. We live in a country where there are a lot of resources available in a person's own community. So sometimes a person may benefit from attending therapy. They may go to therapy once or twice a week. They might attend group therapy. And if they need medication, they may work with a psychiatrist who can help monitor them and prescribe the medicine that's going to work best for them and help them with their symptoms. There are hotlines that people can call that can let them know about resources. The internet is a great resource as well. You can go onto Google and just ask for therapist or psychiatrist near me, and a long list of resources will come up. Sometimes people need inpatient therapy if their symptoms are very, very severe. So this is where they would go to a facility and actually stay there for a short or a longer period of time. But this can be a very helpful experience, especially if you've been depressed very long and have had severe symptoms. If a person is in crisis, they may need to call 911. They also may need to go to the emergency room. And if that is the case, if they are in crisis, the doctors and care providers will work very carefully with them to locate resources and develop a treatment plan. But the most important thing for people to know is that depression can be treated and that people can feel a lot better if they get the right kind of support and get it as soon as possible. So I strongly encourage people to find out what their resources are. So if they're ever in need, or if a friend is ever in need, they know what resources are available.